Hi everyone, can you hear me? Okay. Good afternoon and thank you so much for coming to this talk today. My name is Shruti. I work with Oxford Policy Management, which is a research and consulting firm. And many years ago, I used to work in IFMR Capital 7 years ago, so it's a little surreal to be back in the office and in the cafeteria. For today's talk, I'll be talking about direct benefit transfers. I'll walk you through what is a DBT, some of the operational findings on pain points and process problems in delivery of direct benefit transfers, and end with some recommendations and suggestions on how to improve it. Most of the lessons and findings that I'm touching upon today come from reviews of a number of conditional cash transfer programs, largely in the states of Bihar, Madhya Pradesh, and Rajasthan. So how does a DBT work? So this is how ideally a DBT works. The key mechanism within a DBT is the fact that an entitlement that a citizen has is transferred directly from the government's account to the beneficiary's account. And thereby you're removing middlemen and middlewomen out of the system and reducing avenues for corruption within the system. A DBT also helps identify who should be entitled for a certain benefit or under a certain scheme. It helps reduce deduplication of beneficiaries. It helps remove certain ghost beneficiaries out of the system. What a DBT promises is the right people will get the right benefit at the right time, right? From a policy perspective, it's quite an enticing idea, and successive governments, central, state, across different political dispensations, have been quite keen to use DBTs within different schemes. Increasing financial inclusion, especially post-2011 with Jan Dhan and a lot more people buying into the formal financial system, has also helped promote DBTs across different schemes. So this is a really small snapshot of a handful of schemes that currently use direct benefit transfers, just to show you that DBTs are sector agnostic across different types of schemes. This is data from the DBT portal of India. 439 schemes across 55 ministries, 22 crore transactions, and a savings amount that they claim of over 100,000 crores. So how does a DBT actually work? This is a really simple operational map of a direct benefit transfer. Now this varies from scheme to scheme, but broadly there are these 4 blocks. There's registration. So I become aware of a scheme, I believe I'm entitled to it, and I register with the local service provider. In many schemes, this is the Asha or the Anganwadi. After registration, there's a data entry where someone takes the forms and the identification documents that I've submitted and enters it within the program software. In some schemes, these 2 steps are collated. So let's say the Anganwadi would directly enter your data into the software, but there's some form of registration and some form of data entry in all schemes. There's eligibility determination. So once my data has been entered into the system, the software then verifies whether I am who I claim I am, whether I'm entitled to the scheme. So if it's a DBT for, let's say, school-going girls in rural Bihar, then it verifies whether I'm within the age window of the scheme. Do I have some sort of school registration certificate, etc. And it determines my eligibility. And once that's been determined, it triggers payment. What I alluded to earlier, the money goes from the government's account directly into the beneficiary's account. Most DBTs are recurring, so either they are tranche-wise or, let's say in case of social pensions, I'm eligible to a pension right from the age of 60 up to death, right? So what happens is data entry, eligibility and payment recurs in some form or the other, and there's multiple payments made to the beneficiary's account. This is all really elegant, but not as much in practice. And what we are seeing is delays and barriers at each step of this DBT that's leading to a situation where someone isn't receiving the entitlement that they should be. For today, I won't look at delays to registration, but it's important to note that there's a lot of case study and literature to suggest there are many barriers at registration. This could include someone not being aware of a scheme, not having a bank account, therefore they aren't eligible for a DBT, not being able to register with the Anganwadi. So there's a whole host of problems at that first registration step. But for today, I'll quickly move on to data entry. Data entry is crucial because that's when the program recognizes that you've registered within the system. Even if you've submitted your documents to the Anganwadi, only once the data is entered into the software does the system or the government scheme recognize that you're eligible. Now, there are various reasons for data entry backlog, but most of these are to do with insufficient personnel and insufficient capacity to enter the data. So I'll give you an example for a cash transfer that we were evaluating in Madhya Pradesh. The scheme guidelines didn't have budget for a data entry operator, but everything else in the scheme had to be triggered only after the data was entered. So this led to a situation where CDPOs, who were in charge of delivering the scheme, ended up with a lot of ad hoc solutions. They would ask their assistants to enter the data. There was one instance where someone went to the local photocopy booth and asked the person there to enter the data. This creates a lot of questions around privacy, around accountability, like is the data they're entering correct, who's accountable for it, but it also leads to quite a large delay in entering the data onto the system itself. But let's assume you've managed to enter your data onto the system. What happens next? And that's with eligibility determination. A number of errors crop up here, and I'll walk you through some of this. So this is a process map for a national maternity benefit transfer that we were working on. On the left, in the yellow, is what happens when the whole process goes without any errors. You submit your form to the Anganwadi. She thereon submits it to the supervisor or CDBO. It gets entered into the program software. The data is verified by the software, the payment's processed, and you receive the money. Great. On the right is what happens when there are errors. Now, loosely, I want to term two types of errors, good errors and bad errors. What are good errors? Those are errors that we want the system to catch. I am not who I claim I am. I'm not eligible for that particular benefit. I'm using a fake ID, all of these things. We want the system to capture that, and that's part of the efficiency savings that come from a DBT. But the next set of errors are, well, genuine or bad errors. This could be something as simple as the fact that the data entry operator added an H to my name when it shouldn't be there. I may have gotten married and changed my name, but I didn't update it on my Aadhaar account. The bank account I've given doesn't match with the Aadhaar bank account. So there's a whole host of reasons why this could be. Different schemes have different sort of mechanisms on how to tackle this, but I'll just talk about this one scheme for now. So let's say the system detects an error, and it's the fact that my spelling doesn't match with my ID proof that I've submitted. Now in this scheme, the CDPOs had some power for lower level errors. So with something like your name or like a small error in your date of birth, etc., the CDPO could fix it. And that's good because it leads to an easier solution. It's more localized. But for higher level errors, you had to go to a national correction queue. And this is pretty common across a lot of central government schemes. So for example, in this scheme, one of the triggers for eligibility was your last menstrual period, the LMP. And that determines if you're pregnant or not, are you within the pregnancy window of the scheme. A lot of data entry operators got this date wrong. Even if it was right in the form, it was wrong while they entered it. However, the CDPO no longer had the power to change this because this is a higher level error. What CDPOs did is sent it to the national correction queue. And this is a cell in Delhi that's dealing with errors from all across the country. So maybe Delhi is sending them 50 such cases, Tamil Nadu is sending them 100, Bihar might be sending them 2,000. And there's a single cell that's processing all of this. And as you can imagine, this is leading to a massive delay in processing of a single case. When we were doing an operational assessment of this, we found that the average time taken was about 180 days. And for a maternity benefit transfer, this is a pretty large window. at this point, the pregnant woman is pretty far along her pregnancy if she hasn't already delivered. And what does this mean? It means that the social protection and behavior change aspect of the maternity benefit transfer, they were hoping that the money would help her seek more nutritious food, be able to seek more appointments with the doctor. All of those objectives now get negated because the money hasn't reached the beneficiary in the time period that would have helped influence her nutrition outcomes, help influence her behavior. So we're sort of negating all the social protection outcomes that we were hoping with the transfer. But let's say we did manage to get it to the woman. We managed to solve the error in like 5 days and we got it to the woman within the time period she needed it, right? The error has been resolved. The software doesn't throw up any other errors and we're moving to payment processing. But payment processing in itself is quite a complicated process. So this is a really simple operational flow diagram of how money moves from verification to the beneficiary account. Now again, this may vary from scheme to scheme, but largely these are still the same building blocks. So your scheme MIS over there on the left has verified that you're eligible, sent the information onto the Public Financial Management System, the PFMS. The PFMS then sends this to NPCI, the National Payments Corporation of India. If this is an Aadhaar linked scheme, this is the point at which Aadhaar verification happens. NPCI then releases the payment to the bank. Now beneficiaries might have an account with a rural bank that isn't registered with the NPCI. So then what happens is NPCI sends it to a sponsor bank. The sponsor bank then transfers it to the rural bank and the rural bank to the beneficiary. And along this process, there is a lot of places at which errors are generated. Some are slightly more well documented than others. So this whole Aadhaar verification bit is throwing up a lot of errors and there's a lot of case studies around it. The fact that multiple bank accounts can be registered to a single Aadhaar number, but for a long time it was the last registered Aadhaar number that the benefit went to, and beneficiaries often weren't aware which one this was. So that was throwing up a lot of problems in the Aadhaar verification. They've taken some steps now to rationalize it, but there's a lot of other errors that nobody truly understands, partially because getting this information is quite opaque. So there's been an instances where money's gone from the sponsor bank to the rural bank. So your PFMS has sort of logged that the payment has been made. The money's gone from NPCI to the sponsor bank. So the PFMS has logged the transaction and the benefit has been transferred. But in the transfer from the sponsor bank to the rural bank, there's been an error. So even though PFMS is saying that the money has been transferred, it hasn't actually reached the beneficiary's account. And even with, as researchers with a lot more privilege than regular beneficiaries have, it's quite difficult to access this information and understand why exactly the error is cropping up. So if we go back to that earlier slide over here, we're seeing a lot of delays in payment processing on the back end. But there's also a whole other issue of beneficiaries not being aware when the payment is hitting their account. Because there's not a regular schedule at which they can expect this money to come into their account, they're often unaware. And they're not even sure which scheme this is coming under. So again, the ability of a direct benefit transfer to act as an effective social protection or behavior change mechanism only works if it's regular and if its intent is clear. So if you're giving a health transfer, but your beneficiary is not aware under which scheme they've received it, what the point of that scheme is, then you're not changing much. So I've done the easy bit, right? I've showed you how a DBT works and I've poked all the holes that are there in delivery of these DBTs and why it isn't working the way it's supposed to. But I think most of us recognize that the increasing use of technology in government schemes is here to stay. And when done well, it can actually have a lot of benefits. So for this next part of the presentation, I'd like to focus on what are the state capacity issues we need to focus on to ensure that the use of technology is more efficient and actually leads to both savings and benefits for the beneficiaries there. There are three blocks that I'll use, capacity blocks that I'll use to walk through this. The first is systems, then personnel capacity, and lastly grievance redressal. Systems. So ensuring that the people who design the program software are actually speaking to the people who are implementing it is crucial. Now this may seem like a really simple thing, but it isn't happening and it isn't happening enough. So to give you an example, this cash transfer in Madhya Pradesh that I was talking about, the program data was being generated at the CDPO level, but the implementing officials were at the state level. So what the state implementing cell was doing was sending individual requests to each CDPO within them, and they were then sending data to the state cell. The state cell was sitting and collating it to paint like a statewide picture. I mean, this is grossly inefficient, and it's one of the promises that technology makes to us, right? That this sort of inefficiency will be taken away. All it needed was a really simple program design kink. But what that needed was for the person who was designing the program to speak to the person who's going to be using the program. And that feedback loop is broken. So ensuring that we're designing systems that make sense for the people who are using them is crucial. The second bit is around personnel capacity, and this is really important. For those of us who are designing policies, to understand that different functional competencies are required to use technology, and what that means in terms of budgeting, in terms of staffing. So just to go back to the example I gave you earlier about not accounting for a data entry operator in the budget, that leads to the whole system having a backlog and not delivering the benefits that it's supposed to. So ensuring that we understand what sort of functional competencies are now required and accounting for them in policy design. Ensuring that there are adequate training sessions for service delivery providers. So invariably, the ASHA or the Anganwadi has 1,000 schemes and 1,000 new technologies that they're expected to use. In a cash transfer that we were working on in Bihar, we had a smartphone for each Anganwadi and a preloaded app. And then she could just put in the beneficiary data into it directly. We thought this was really simple. We had training sessions with the Anganwadi. But what we noticed when the program was running was that what most Anganwadis did is that they still noted everything down in their register, went either that evening or the next day to their sons and daughters and asked them to input the data. So clearly the trainings we gave them were not enough. So ensuring that we are giving the right kind of trainings and repeating them so that service delivery professionals who already have a really humongous workload understand what sort of systems that they're supposed to use and and have ease in interacting with them. And the last bit is understanding how data can be used. So each of these schemes is actually collecting a lot of really rich data around socioeconomic indicators, health, nutrition, education, that can be used for funding decisions, for implementation decisions, for staffing decisions. But what we see is invariably there's one success metric, right? Either it's the number of beneficiaries that are enrolled into the program. If you look at the JSY, then it's the number of institutional births that have happened. So there's one success metric that everybody in that department or in that cell is really focused on, without understanding the wealth of data that is actually available to them and how they can use that to guide decisions. So working with implementing officials to help them understand what is the data available under the scheme and what impact does it have for their day-to-day decisions is really important. And the last, and in some ways for me the most important part of it, is grievance redressal. What we've done with the use of technology is remove the traditional power brokers. Your local MLA, your panchayat leader, your Anganwadi, your ASHA no longer have influence or information about what's happening on the back end. To us that may seem like a good thing. That reduces potential nepotism, that reduces potential corruption. But we haven't actually replaced this with an alternate grievance redressal mechanism or an alternate avenue for beneficiaries to seek information. So often what happens when someone doesn't receive their entitlement is they still go back to the Anganwadi, they still go back to the panchayat leader, but they no longer have information and the beneficiary doesn't know who to ask for information. The banking system may not have the answers and it's not something that a lot of beneficiaries are comfortable engaging with on a day-to-day level. So ensuring that we replace it with a new sort of grievance redressal mechanism that's actually able to give beneficiaries the information that they need is crucial. And even from an implementer's perspective, there's, again, the feedback loop is broken, right? A lot of implementers don't understand at what point the system or the process isn't working. There's limited accountability because all your elected leaders will say, actually, I have no information on this isn't my problem. They're correct in saying that, but there's no real accountability. So making sure that for DBTs, we have robust grievance redressal mechanism and information kiosks is really important. Some of the key themes and capacities that I've addressed here, I've looked at it through the lens of DBT programs that we've evaluated. But these are similar questions that we're seeing across other programs that use technology. If you're looking at app-based monitoring of schemes, if you're looking at social registries that help identify who the right beneficiaries are, similar themes around personnel, around systems design, around the lack of grievance redressal mechanisms keep coming up. And if we recognize that technology in the use in delivery of government schemes is here to stay, then these are capacity blocks that we need to address across different schemes. And we need to recognize that using technology or designing a software isn't it. We need to invest in the complementary personnel, systems, and capacities that are required then to use that technology. I mean, the ultimate aim still remains the same, right? It's social protection or health or nutrition or education, depending on your scheme. It's not designing a new technology. So how do you then develop that capacity to use technology and deliver the same outcomes becomes really important. And if we don't do that, then what we're going to do is take the paper bureaucracy that we have, replace it with a technology bureaucracy. And this technology bureaucracy is in many ways more opaque and less accountable than the paper bureaucracy that we started out with. And I'm sure that that's not an outcome that any of us in this room want. Thank you. Any questions? Yeah.
So what happens if there's a condition attached to the cash transfer? I think these maternity benefit schemes are also linked to X number of doctor's appointments.
Yeah, so that comes in your eligibility determination. So what happens is the first tranche is generally just on registration and showing that you're pregnant. Then in the second tranche, you have to show that you visited the Anganwadi or your weight and height metrics. So generally at the village health, sanitation and nutrition day, they note all of this down. Yeah. So then that counts towards your eligibility determination for your next tranche of payments.
Oh, okay. So at each stage of the battle.
Yeah, so if you go back to this thing, every tranche you again do some data entry, right? So if it's your second tranche, then the Anganwadi will be entering data around how many doctor's visits you went to, what your height and weight is. Again, the system will determine if you've met the conditions for that tranche and then trigger payment. So each time that you need to receive a payment, that keeps recurring.
So as part of your research, you've done like a top-down analysis of DBTs, or are you looking at specific schemes apart from maternity?